Hi everyone, my name's Harriet. I'm a third year medical student at Exeter University, and I'll be just showing you a bit about what my life is like in this video, so I hope you enjoy it. So just to explain to you guys a little bit more about what my day-to-day kind of life is, we'll put up a timetable now, which shows our typical day or typical week, sorry, when we're on placement. So we have kind of different types of weeks in medical school, but placement weeks are the sort of most common weeks that we have. And that's where you have an academic day in the morning. And then depending on what your rotation is, so you could be on medicine, surgery, or specialties. And then within each of those, there are different rotations. So I've been on medicine for this term, and I've done lots of different rotations, such as cardiology, respiratory medicine, elderly medicine, etc. So on a placement week, we have the first day of the week is the academic day. That's when we do things like small group sessions, clinical skills, lectures, tutorials, and we sort of do the academic aspect of medicine. So that's the first day. And then for the other 4 days of the week, we're in placement, usually about 9 to 5, although it can vary depending on sort of where you're placed. Then other weeks that we have are SSU weeks, which is what I've been on this past week, which I've been filming for you guys. So SSU week is where you sort of study just this very kind of medicine, on arts or humanities or medicine or science. It really can vary, and that's where you get to really focus on that. And what we have to achieve at the end of it is creating a poster and setting out a business proposal, things like that. So on SSU week, you just have your SSU contact sessions, which are with your SSU provider, and that's sort of it for SSU weeks. So SSU weeks are usually a little bit more quiet compared to placement weeks, where we're in all the time. And then the final sort of type of week that we have are community care weeks. So that's sort of focused on general practice and medicine in the community. So in our last community care week, we learned about sort of the challenges that face GPs and the kind of benefits of being a GP, the cons of being a GP. We got to look at how medicine in the community had changed due to COVID. And it's really interesting to kind of explore different career options. We spend a lot of time in the hospital, but general practice, although we get a lot of time with general practice, we actually don't get much time to talk about the kind of careers aspect of it. So it's really nice to understand more about how a GP practice works and all the different roles that are in the community as well, because it's not just GPs, there's community hospitals and sort of different clinics and things like that. So yeah, those are the main weeks that we have in medicine. As I said before, the sort of primary or the most common weeks that we have are placement weeks, but we have just the community care weeks, occasionally SSU weeks. We have 6 SSU weeks over the year. So they're nice kind of breaks from the sort of day-to-day of going into placement, and yeah, they allow you to sort of relax a little bit. I hope that sort of explained things for you guys. So I've just sat down to start doing a bit of self-directed learning. So I have a CBD, a case-based discussion with my consultant from my placement last week, which was on elderly. So I'm just going to sit down, read a bit about sort of a bit more about the patient and the patient's conditions, using my iPad, which we got given this year, which is very exciting, and make some notes on just Microsoft Word about that. So I better get going. So I'm just sitting at my desk about to get ready for my SSU session today. So SSU is a selected study unit, and it's a part of the course where you get sort of a bit of autonomy about what you learn. So this year, and it can be really varied. So sometimes it's sort of hospital placements, other times it's kind of research placements. And for this year, the SSU that I'm doing is about COVID, and it's sort of focusing on coding and machine learning. So in my SSU, what I'll be doing is learning how to code, which is completely new for me. I'm a bit nervous about it. And then we'll be taking a data set about a sort of COVID patients and whether they went into ICU or not, and then sort of lots of different factors about them that might have influenced it, so their age and any comorbidities, what their sort of vital signs were when they first entered ED, and we'll try and make an algorithm that can predict how likely or whether someone is likely to be admitted to ICU or not if they present with COVID. So it's obviously a really topical sort of thing to be working on. I hope that it can help the pandemic and our management of COVID patients. And I'm going to learn something completely new. As I said, I've never done any computer science or coding before. This is a really fun part of SSU, or the really fun thing about SSU, because actually you get to completely branch off from medicine. So if you want to stick with sort of hospital placements and things like that, you can. But I have friends who've done art SSUs. I've had friends who've done music SSUs. One was a creative writing SSU. So it really gives you an opportunity to kind of, expand your horizons. So I'll let you guys know how the session goes. So I forgot to film after my CBD and my SSU session last week. So I thought I'd just give a little update. So both of them were really good. The CBD was a really great learning experience, managing to sort of present cases to the patient and get her feedback about it is really invaluable. It's really nice that we have that time blocked out with consultants, because obviously they're probably the people in the hospital that are most under time pressure. So it's really nice that we get that time with them and they can give us some of their expertise. So that was really, really, really useful experience. And my SSU session was great. I'm really enjoying learning about a completely separate sort of subject from medicine, even though obviously it's still using sort of medical data. So it's very interesting. I'm learning how to sort of use different programs and how to go about sort of data analysis, and getting lots of support from my SSU supervisor as well, which is great and very much needed because I'm not the most technological person. So yeah, it was a really great week last week, and very excited for this week, which is another SSU week. So I'm doing a different SSU this week, and then we break up for Christmas, and then from sort of next term I'll be back into the timetable I told you about of the academic day on the first day, and then in placement all week. So yeah, very exciting. So one of the things that I really like about medicine is how much collaboration and sort of teamwork is involved in the course. So we've got an OSCE coming up, which is sort of a clinical exam. And we know that the OSCE is going to be taking a history from a confused patient, and it's going to involve us doing a cognitive assessment as well of the patient. And so me and my friends have organised to practice for the OSCE together. So one of us will be the medical student, and the other person will be kind of the role of the confused patient. And it's a really nice way to sort of improve your skills and make sure you're prepared for exams. It also gives you a little bit of a break from the sort of more academic side of studying.
Hi, my name's Sham. I'm a third-year medical student from the University of Exeter. I'm just working with your doctor today. I'm just wondering if I could have a chat with you about why you've called in today. Is that okay with you? Hi. Can I first of all just confirm I've got the right patient? Can I confirm your full name and date of birth?
Yes, it's January Flashman.
Okay.
And my date of birth is the 5th of April 1942.
Thank you. And what do you like to be called?
Jan.
Thank you, Jan. All right, Jan. So why have you called in today? What's up?
So I just got a bit of a cough. It's been going on, for the last couple of days, and I got a bit worried it was COVID, but I had a COVID test and that came back negative. So yeah.
All right. Okay. Could you just tell me a bit more about the cough?
Yep. So it started. Well, I don't know. It probably started like properly about a week ago. But it only started to get worse to the point that I started to worry about it in the last 3 days. It's I think it's a chesty cough. It feels chesty, and
Okay, thank you for sharing that. Have you been experiencing any shortness of breath with that?
A little bit, yeah.
A little bit. Is that there all the time, or is it particularly bad when you're doing something else?
What do you mean?
As in when you're exercising, for example, if you're being active.
Yeah. So when I usually walk down to the shop to get my paper, and it does get worse then, yeah.
And worse than before you had the cough, yeah?
Yeah. Usually I'm really healthy, actually. I'm really healthy for my age.
That's good to hear.
So thank you all so much for watching. This concludes a day in my life. I hope that you enjoyed it, and I hope that you kind of got to appreciate how varied the content and the learning styles are within medicine. The diverse range of things that we do is partly why I wanted to apply for medicine in the first place. So hopefully that sort of come through. Thank you very much. Bye.